Welcome to this edition of the First Aid Show. When you treat a child, this is very distressing for everyone. In this film, we asked a paramedic for ideas on how you can manage the treatment of a child in an emergency and how you can help the parents to cope with the situation.
So if we're ever called to a sick child, some of the really important things that I would like to share with you is, number one, the parents know their child really, really well. If a parent has got a bad feeling that the child is just not well or something's not right, we always trust that parent's instinct because they know their child well. Try and ask them to explain clearly what is different, why they are concerned, what's abnormal, and put it into words. So is it a problem with breathing or feeding or their alertness? Whatever it is, try and get them to explain that clearly and remember what they've said. Another thing we do with children is, obviously they cannot always tell us what's hurting and what's unwell. So we look for all the good, obvious, basic signs that we can identify when we look at a child. So we look at the child's tone. You know, are they moving their arms normally as you'd expect for a young child, or are they floppy? Floppy is not a good sign. We're not expecting any children to lose their tone, so that is something that causes concern. We're looking at the colour of their skin and how well they react to you, to toys, their parents. Can you console them? And the other thing we're looking for is how good is their circulation on their body. So if you notice that they have become mottled or they're changing colour and they're not a nice healthy pink colour, that again is another cause for concern and they do need medical help. So obviously a sick child is a very distressing situation and parents can become quite emotional. It is our job to reassure them that we are here to help and establish a really good rapport with the parent and with the child that allows us to expedite getting good medical help to that child. So whatever you can do to reassure them, assign them a job, get them to go and look for their red book if they're a young child or a baby, get a spare nappy, get a feed, get a change bag, give them a purpose and a thing to do. If there are two parents on scene, always allow one of the parents to be involved in dressing or undressing the child, holding the child, carrying the child to the ambulance. Things like that allow them to have a purpose and feel that they are helping and assisting.